coronavirus pandemic has increased uncertainty over jobs, the economy, unemployment, finances, relationships, so much more. And it's really having a major impact on physical and mental health. With no end in sight and the infection numbers that keep going up, how can you adapt, build resilience and develop mechanisms to help you cope during these uncertain times? Let's unpack this now. We're joined by clinical psychologist Leonard Carr on the line. Leonard, thanks very much for your time this morning on the AM Report. I mean, I myself have spoken to friends and family who, experience moments of such uncertainty that they really do feel depressed. It's difficult to plan for a future that is so uncertain. What are you hearing from people perhaps who are approaching you for help and for advice?
Well, I think there are many different experiences, all centering around the uncertainty. For some people, the financial uncertainty is a priority. For other people, the fear of being ill or the fear of other people, their lives being ill. And as you mentioned, not knowing when this is going to end. And I think also the confusing messages from authorities, from government, from health workers. It's kind of like children who know that something's wrong, and the adults are talking about it but not really informing you about what's really going down. And so there's a lot of anxiety, and there's also a sense of loss because all our certainties have been dismantled. Our lifestyle, there's so many changes, and that creates a sense of loss. So, people are also grieving for what they've lost. And because we can't predict the future, we live in this sort of state of uncertainty, this betwixt and between state. And it's hard for people to get their bearings and to know how to anchor oneself.
Yeah, and I suppose
what to hold on to.
Leonard, the issue around, we've obviously heard the stories of people losing loved ones, the fact that their loved ones were admitted to hospital, and that in many respects was where they had to say goodbye if those loved ones didn't pull through, if they died. And then the process of then, laying loved ones to rest, bidding them farewell. It's so completely different. It doesn't offer any closure. That must have a major impact, not only on the people who have experienced it, but for the fear of people who think that they might experience it.
Absolutely, and I just want to add to that point of saying goodbye to loved ones, that the people are having experiences of loved ones going to the hospital, and even spouses and children not being admitted into the hospital because of COVID, even if the loved one is there for something else. And so I think that it makes people feel even more cheated by the person's death. And, all the rituals that we have of closure are part of the psychological process, what helps us with the psychological process of coming to grips with the reality. And when one lives in a state of unreality, when you don't have reference points, and when you don't have actually lived experiences that help you to grips with the reality, you feel kind of unhinged and disorientated. And it's difficult to actually go through all the feelings because it feels surreal. But also, the sense of being cheated, the sense of being robbed by this whole experience. And sometimes that anger goes out to doctors or governments or, who can we blame? See, there's a lot of blame going on in this whole story, and that's people's anger at their sense of disenfranchisement and helplessness, that they don't know who to put those feelings onto.
Yeah, and in one of your videos you address this issue. It's not the same as disasters, for example, like 9/11, where it's a major world event that sort of shakes your reality. This is so completely different because this is the first pandemic many of us who are alive now are actually trying to live through. So perhaps let's end off our interview on a positive note and offer some advice to people who are struggling with the kinds of feelings that you've described.
Well, I think that you have to find your certainties, and your certainties, the things that you can hold on to, where you can draw strength and courage from, are the times in your life that you've been through challenges and you've overcome those challenges. think of what resources within yourself you mustered up to overcome those challenges. Your strength, your courage, your resilience, tenacity, your wisdom. What did you learn through your experiences? How did the difficulties you've been through in life make you a better, stronger, wiser, deeper person? And then also think about the person that you want to become through this. This is a chance to work on compassion, to work on one's sensitivity to the people around you, to deepen your family relationships, to develop new hobbies or new interests that you haven't had the opportunity to do before. So I think that if people put their minds to it, they could turn this into one of the best times of their lives. And if you don't focus on the fear and the negativity and the loss, but you actually focus on the opportunity that this whole situation is really pregnant with.